What determines health outcomes? According to the Yale Global Health Leadership Institute, social, environmental, and behavioral factors contribute 60% to health outcomes of individuals living with chronic diseases, while clinical encounters such as outpatient visits, hospitalizations, and medical procedures only contribute 20% to outcomes of chronic disease. Did you know? The United States spends more on health care than almost any other country, yet often underperforms on key health indicators including life expectancy, reducing chronic heart disease, and maternal and infant mortality rates. Also, national health spending is projected to grow rapidly and reach $6.2 trillion by 2028. It's no surprise that Centers for Medicare and Medicaid Services issued guidance to state health officials to drive the adoption of strategies that address the social determinants of health so they can further improve patient health outcomes and lower overall healthcare costs. How can we achieve this? While one-on-one clinical encounters are the mainstay for acute care, they are not adequate for chronic disease management. This model has quickly become outdated and inefficient, especially in the wake of high demand and utilization of healthcare resources due to the COVID-19 pandemic. Traditional office visits are cost-prohibitive, offer limited clinical contact time, require high resource utilization, and do not address social determinants of health. What's more, clinicians are burned out and healthcare costs keep going up. This is why WellnessWits is providing an innovative approach to improving clinical outcomes while saving healthcare costs and resources. Introducing Group Therapeutics, a unique digital therapeutic solution with an end-to-end open platform for proactive chronic disease management through virtual shared medical visits. With a single clinical encounter led by a physician and a dedicated collaborative virtual care team, patients can spend more time in a follow-up medical appointment while gaining social support and accountability from other patients like them with similar lived experiences of their chronic diseases. Group Therapeutics offers prospective need identification, clinical risk stratification, targeted interventions, closed-loop monitoring that drive down costs, save time, and optimize health outcomes by addressing the social, behavioral, and environmental determinants of health. Why Group Therapeutics? Discover customized interventions for end-to-end services for multiple therapeutic use cases, clinical surveillance based on AI models to mitigate care coordination exceptions, streamlined chronic care for clinical effectiveness, cost-saving risk-based payer reimbursement model, managed clinical narrative for social groups that mitigate unregulated social media content. Get ready for a new wave of healthcare innovation that invokes positive change in favor of patients, providers, and payers. It's a win-win-win. Contact us for a live demo of how Group Therapeutics can help you transform your health as a patient or reach your business goals as a provider or payer. Group Therapeutics, powered by WellnessWits.